My name is Cathy. When I first noticed that I had a problem with my neck, my back, was when I was working out, doing spin classes and Zumba classes. The spin instructor had told me I should get my neck and shoulder checked out just in case it was something worse, like a torn ligament or something of that nature. So I decided to go to a hospital that my insurance covers in Ohio, and I went through about 6 weeks of physical therapy. That was what the doctor directed me to do. So after going through 6 weeks of therapy, I was still having extreme amounts of pain in my neck and left shoulder area, and it was at a point where I felt it was a bit debilitating. I was taking medication for pain, a lot of medication, Tylenol, Vicodin, that kind of thing, and it just wasn't fixing the problem. And so the physical therapy obviously wasn't working. I went back to that doctor and asked if I could get a cortisone shot of some kind, and she had informed me that she believed it to be a pinched nerve, and just basically directed me to do more exercises, perhaps even signing me up for more physical therapy. Well, at that point I had asked for an MRI to be done, and I went through that process and was told after doing that I had a herniated disc. And after looking at the disc, or the CD with my x-rays, there were other discs beginning to protrude, so I would have had more problems later on had I removed the disc that they had intended for me to do, which was to have surgery. And so to avoid having more surgeries, I decided to check out my other options, get second opinions. My mother happened to be listening to the radio and heard Dr. Manila discussing his treatment center, and he had patients on the show, and they were talking about their results and how successful they were as far as getting treatment. And so I decided to visit the Disc Institute and speak with Dr. Manila one-on-one, have a consultation. I brought in my MRI CD. We took a look at that, went over all the options and what he could do for me in order to avoid surgery, which would have ended up making things worse in the long run. I have to say I am pleased with the results. I am now able to actually function without having to take pain medications every day. I don't wake up and go to sleep at night in pain, in constant pain, and I can do most activities. I'm now actually involved in a play which involves a lot of physical dancing and all of those things, and after going through a rehearsal last night that involved choreography and dancing, I have to say that today I feel perfectly fine. I don't really have a whole lot of issues with my neck and my back, and even driving has gotten better because I had trouble driving for long distances with the pain that I had in my back. So in the long run, I would say that this was a successful experience, and I am glad I decided to make this my option rather than surgery and come and do the treatments that they offer. So I avoided even worse symptoms and even worse results by avoiding surgery in the long run. So thank you so much, Dr. Manila, for helping me with my problem, and I'm very grateful.